at 10:32 a.m. First on the agenda is welcome Mr. Timothy Gottschall. He's a supervisor for Richland County Board of Supervisors. So Tim, welcome. Most of Health and Human Services here probably would remember Tim as being a former employee, but he's now here. And then I guess since we're here all together in person today, we're only missing Dr. Barris. I guess we got a couple new members, so I'd like to do introductions, I guess. So I'll start. I'm Kerry Severson. I'm a county board supervisor. I don't know if Andy want to go.
Tim Gottschall, county board supervisor.
Ingrid Glassbrenner, County Board Supervisor.
Megan Rom, Confidential Administrative Secretary.
And Tracy Thorson, Health and Human Services Director.
Thank you all for introducing yourself. Dr. Barris is not going to be here today. He sent me an email yesterday and said that he had other stuff to do, other commitments, I guess. So we're going to move on to agenda item number 2, which is our posting. Was this meeting properly posted?
Yes, it was.
Wonderful. Then I would entertain a motion to approve a 15-point agenda. Motion by Diane Cox, seconded by
Second.
Supervisor Nelson. Any further discussion? Hearing none, all those in favor signify by saying aye.
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 Those opposed say nay. Motion carries. Move on to agenda item number 3, which is approve our May 13th, 2021 Health and Human Services Board minutes. Are there any additions or corrections to these minutes that need to be made? Hearing none, I would entertain a motion for approval.
I move they be approved.
Motion by Cindy Chicker. Is there a second? Seconded by Timothy Gottschall. Any further discussion or corrections with those minutes? Hearing none, all those in favor signify by saying aye.
Aye.
Those opposed say nay. Motion carried. Moving on to agenda item number 4, citizen comments. Are there any citizen comments? Are there any citizen comments? Any board members wish to comment under citizen comments? You can if you would like. Are there any citizen comments? Hearing none, we'll move on with our agenda to agenda item number 5, which is our director's report. Tracy?
Thank you, Mr. Chair. So first, I'd like to share an update on the resolution relating to masking that this board had forwarded on to the county board last month. The county board passed the resolution with an amendment. The resolution advises that all individuals entering county-owned buildings should be strongly recommended to follow current CDC guidelines, and the same would be true for county employees, which is why we are not currently required to wear masks in the building as long as we're following CDC guidance. The county administrator did issue an administrative procedure to provide implementation guidance on the resolution. It states that fully vaccinated individuals and employees are not required to wear masks in county-owned buildings, except for those buildings and departments delivering healthcare services, which may continue to require and enforce masking and protective gear and social distancing. So as a provider of healthcare services, Health and Human Services continues our requirement for masking and social distancing in the community services building. We will regularly review when it's appropriate to adjust our practice. Sure. All right, so let's see here. With regard to the roofing project, we did experience another issue with our construction. About 2 weeks ago, overnight rain apparently came through the construction area into the building, causing water damage and ceiling tiles to fall in the ADRC area. Dennis, our custodian, was able to clean up the mess and order replacement tiles. Russ Mons, the county's project engineer, was contacted to address the issues with roofers. The total expense related to that and the previous damages have been approximately $1,021. Mr. Mons is helping to assure that this expense is recouped from the contractors. The roofing project isn't done yet. The contractors are completing the sheet metal installation that seals the perimeter of the roof and the vestibule. We don't have an anticipated final completion date for that, but they're working on it today and have removed all other supplies from the parking lot. For economic support, I'd like to point out that next week is Economic Support Specialist and Case Manager Week. Governor Evers signed a proclamation to recognize the staff who administer the state's public assistance programs and ensure the well-being of our most vulnerable populations. We're fortunate to have highly professional and caring staff at Health and Human Services doing this very important work. As I've been saying for the last several months, economic support programs continue to operate with more relaxed requirements for food share, Badger Care, and Medicaid because of the pandemic. Some timelines continue to be extended out or waived for now. Stephanie Ronfeld, our economic support manager, continues to participate on a local child care task force. And Jessica Stanek, our child and youth services manager, will also be joining this task force. The group is focused on addressing the significant shortage of childcare resources in our area. You may have heard about the group's efforts on WRCO recently. During the radio spot, Extension educator Chelsea Wanacke promoted the Build It Strong provider training. This is a free training that is meant to assist current or potential new providers with knowledge needed to run safe and successful childcare businesses. In behavioral health, our substance abuse treatment professionals are working with residential treatment providers in order to provide a link for clients in need of these services and assist eligible individuals to access the new Medicaid benefit that covers residential care. June 15th is World Elder Abuse Awareness Day. Please check our Facebook page for posts this month to raise awareness and learn about prevention of elder abuse. This day is also an opportunity for us to recognize our own adult protective services staff who work every day to protect elders, elder adults, and other adults at risk in our community. Last year, there were 48 elder abuse and neglect cases investigated by our APS staff. Birth to 3 will begin the search for a part-time educator to work with families. As you probably know, the Birth to 3 program is an early intervention special education program that supports growth and development of children under the age of 3 who have either a developmental delay or disability, and the program requires this educator service. We haven't had an educator for some time. In child and youth services, the biggest thing to note is our staffing concerns with the resignation of 2 case managers. Existing staff will be stretched until we're able to fill these vacancies. We also are seeking to fill a part-time family preservation position in order to address support and education needs of families involved in services. The ADRC will be hosting a late summer event called Alive and Kickin' the August 26th. It'll be held on August 26th at the community center. It's expected to be a fun music-based program along with a short play to bring awareness to the community about dementia. And finally, I would like to share with the board that our ADRC manager, Roxanne Kluber-Tons-Gerber, recently received the 2021 Healthy Aging Star Award. It was the In Cahoots Award from the Wisconsin Institute on Healthy Aging, and it was presented at a virtual Healthy Aging Summit on June 4th. Roxanne was recognized for her leadership and the ADRC's work in collaborating with Simon's Recreation to expand the health promotion programs for older adults and people with disabilities. The programs that were promoted were Stepping On, Tai Chi, PALS, and Strong Bodies. So congratulations on this recognition to Roxanne. Mr. Chair, that's my report. Are there any questions?
Any board members have any questions for Tracy? Wonderful. Is anybody from the public on to have any questions? We'll move on to our next agenda item, which is number 6, our health officer update and COVID-19 response. Rose?
Hello and good morning. Yes, in public health, we're staying the course and we're beginning the process of reopening some of our programs so that we're having a bit more involvement from the community here in our building as well. With regard to contact tracing and positive cases, in the last 2 weeks, we've had 11 new cases and we remain at 6 active cases as of this morning. Tracy does have statistics which will reference both case activity and COVID-like illness and influenza-like illness activity in Wisconsin and in Richland County, as well as our vaccine data. Right now, for Richland County, 47.5% of those who are eligible for vaccines have received at least 1 dosage. And I'll just draw out 2 different age categories, and that would include 81% of those equal to or greater than 65 years of age. And those who are between the ages of 12 and 15, 21% have already received at least 1 dosage. And that's a fairly quick turnaround, knowing that not even 1 month has elapsed since the emergency use authorization for children in that age group were approved. And for those who have completed the series, 43.6% again of those who are eligible in Richland County have completed the series, and that would include 78.4% of those equal to or greater than 65 years of age, and 2.5% of those in the 12 to 15-year-old age group. So just some statistics about that. Case activity, as far as COVID case activity in Richland County, does remain high, although it's considered moderately high. It takes very few cases to pivot our county from being moderate to high, and we've seen that fluctuation over the last month or so. We were at moderate activity in early to mid-May, and then just a handful of cases will change that. So we remain at high activity right now for COVID cases. And with regard to and then I'll have Tracy share her statistics here when she has an opportunity, but I wanted to share that with regard to our nutrition program, we have reopened the dining site at the Richland Center location. It is being operated with fewer days and with a more limited capacity. However, we are committed to reevaluating both the capacity and the numbers of days that the site is open after about a month. We want to take a look. I want to let at least 2 different incubation periods elapse to find out whether or not the safeguards that we have put in place are being effective. And if so, we'll look at one of 2 things, either increasing capacity or increasing the number of days. I will admit having folks return has been a bit slow, so it may be difficult to really get a good idea of how well those safeguards work without having a real good litmus test for that. So we're also looking at reopening the Germantown site on the 30th of June. And then because of construction that's occurring at the Rock Bridge School, we'll be looking at reopening the Rock Bridge site on July 7th. And of course, those will also have safeguards in place. And I wanted to let folks know that because I will be providing vaccines at a location outside of Richland Center today, I may have to leave early depending on the length of our meeting. So if you do have an opportunity to call on me to discuss our annual report, if I had the ability to go sooner, that would probably be a best case scenario. Thank you.
Thank you, Rose. Are there any questions for our health officer? Ms. Chicker?
I just have one. Rose, any assumptions, ideas, et cetera, as to why some of the age groups are not reaching out and getting vaccinated? Has there been an attempt to discern that?
There are attempts that are occurring actually as we speak. I know that the state of Wisconsin is looking at that they're looking at both vaccine confidence and vaccine hesitancy. I know that Southwest CAP has employed some community health workers who are working specifically on meeting with health officers and public health staff to take a look at the vaccine landscape in their locations and to really look at utilizing resources that already exist. I know the state of Wisconsin has created some resources that can be made public, but also taking a good look at reaching out to the different folks in the different age groups in our counties. Knowing that many of the counties that Southwest CAP serves are rural in nature, looking at that will be a real big focus. But that work is actually in motion right now. However, there's a bit more information gathering that's occurring, but it's happening. So folks are looking at those. As far as thoughts, I know that there are folks. There's such a spectrum of opinions. Some folks are very concerned. Some folks have little or no concern regarding the illness itself, let alone whether or not the vaccine is effective or is it not. What are the risks associated with vaccination? Are there concerns? And then there's both religious and political leanings as well that help to color folks' opinions as well. And there appears to be just about any source of information that would support anyone's view. So I might utilize the CDC, Department of Health Services, FDA, things of that sort to support my view. But other individuals who don't perhaps support that view also do have access to information as well, which tends to support that. So when people feel supported in their opinion, sometimes it's difficult to change how they feel. However, we're committed to bringing as much vetted and information from the most scientific sources so that folks can hopefully feel comfortable with considering getting a vaccine.
Thank you.
Are there any other questions? Anyone from the public have any questions? Thank you, Rose, for your report. Move on to our agenda item number 7, review and approve Health and Human Services vouchers. Mrs. Hampton, she would be our Business and Financial Services Manager. Robin?
And Mr. Chair, it's just going to take me a minute to pull them up on the screen for Robin.
Morning, everyone.
Morning.
Morning.
There we go.
Okay, we'll get started. We have a total of 39 vouchers this month, excuse me, for a total of $30,463.56. The first 1, 2, 3 pages are the mileage reimbursement expenses for the transportation program. So with that, we'll skip to page 4. Highlight the second one down, it's line number 4 for $247. I should actually start off by mentioning this page and the next whole page for a total of $4,217.59 is our whole credit card bill for this month. So just highlighting some of the notable items that aren't routine purchases on the credit card bill. This 247 was for our front desk staff. It's an active shooter training, and we're looking at having more in our agency watch that training as well. Going into the last two lines on the page should be line 1 and 2 for a total of $671.86. When you combine the two lines, these are promotional bags to be used for the ADRC program from some of the funding they had for those purposes. Skipping page 5, it's the rest of our credit card bill, but the rest of these items are reoccurring or routine charges. Going on to page 6, middle of the page, be line 38 with JComp, and actually 37, I was going to highlight the next line as well, for a total of $3,767.98 to JComp. The first item was a computer for our COVID / vaccine staff that we hired through Southwest, and that's actually reimbursed by COVID funding. And the second one down is a computer purchased for our the new lease family preservation worker that we hired for the children's unit, and we had additional funding in our PSSF program to cover those charges as well. Just want to highlight the last one on this page. This is our first bill of the year for passages. We pay $2,600 a year to support passages, and it's a kind of community support thing. I think that's been going on for quite a number of years, right, Angie? So that's just the first payment we've made to them. Nothing real notable on page 7. All routine expenses. The very bottom of the page on page 7 into page 8 is our Richland Observer bill for a total of $1,022.50, and most of it, I think actually all of it, this month is ADRC ads, except for the very, very bottom line, the $83.60, that was a purchase on behalf of the county, and that was not paid for out of our funds. It was paid for out of the courthouse funds. But the rest of it was the ADRC ads. We had caregiver workshops, dementia book clubs, and they did a lot of advertising through ADRC funds this last month. And the shopping news is line 54, mid-page. It's for our social work position. And the rest of them were our routine items. And so nothing notable on page 9 or actually page 10. Those are both routine bills as well. Any questions about the vouchers? And I mistakenly forgot to send a sign sheet with Megan, so I'll have to email you all. You guys can reply once there's an approval or whatnot, reply to the email for approval. But pending any questions.
Any questions for Robin on our vouchers? Wonderful. I guess a motion would be appropriate to approve those vouchers. Motion by Diane Cox to approve the vouchers for the last month. Is there a second? Seconded by Mr. Gotcho. Is there any further discussion on the vouchers? Hearing no discussion, all those in favor signify by saying aye.
Aye.
Those opposed say nay. Motion carries.
Okay, you all will get an email shortly then and reply to the email approved, so I can have that for the clerk's office to cut the checks today.
Thank you. Let's move on to our budget summary and county placement report.
I think that Robin will talk about the budget.
Oh, I was on mute, sorry. I started. Okay, so we got that up. So this is through the month of May, the 2 orange tables, and the placements is always a month behind, so it's April. Going over the utilization table, the first table, we should be at approximately 42% this month. We're underutilized in a few areas and over in one, and I'll just, as I typically do, go through that and provide some context to the whys. Starting off with administrative services, our building and operations cost is at 18.2, so quite a bit lower. But in July, we get hit with some pretty big charges from workers' comp and insurance costs and whatnot. So we are pretty confident we're going to spend that budget. It just starts off with the expenses slower in the year. On to public health, you can see this is at 48.8%. We're overutilized. A lot of our COVID expenses are coded here, which we get reimbursement for. So while there's the additional expense, there's also the additional revenue to cover that. So no concern with that being overutilized. Skipping down to CPS Contractual Services. This is basically family dependent, and it's just lower this year, probably due to COVID or whatnot. Then to behavioral health, the first line is at 25.1. This is a mental health outpatient crisis, as well as the APS line, which is a few down, is lower. These two are both due to the APS crisis positions being unfilled this year. Let's see here, what else do we have? The second line down, the AOTA outpatient being underutilized is due to a change in staff this year, and the new person didn't take health insurance, so that significantly impacts the budget by not taking that health insurance. And then the last two, the birth of 3 and the CLTS, Children with Disabilities Program. These are, again, based on the number of kids, and we've just had less this year. Moving to the middle table, we've got the revenues minus our expenses with some kind of projections of what's outstanding for revenues expenses there. Leads us with a budget balance prior to any chargebacks for the Mental Health Institute charges, the Winnebago charges we talk about every month, of $59,549. I'm happy to say that Josh in the clerk's office is well underway of making our chargebacks a reality. He understands the whole accounting side of things, so he's making it happen. So after all the chargebacks, we are seeing a positive balance of $108,863. And a comment I wanted to make on that, and it slipped my mind. Last month that was at 41,496. Where I would say starting to see more of a surplus, or I would say surplus balance emerge. And I would say that's a lot due to the unfilled positions as well. So that number still is pretty variable at this point in the year, because we have pretty big factors of unknown factors in the budget at this point. So while I'm bringing that number forward right now, that still is an estimate. Any questions on that? If not, I'll turn over to Tracy for the placement report.
Sure, that's one quick question.
And then Robin, Timothy Gotchel would have a question.
I hear somebody talking, but it's really, really quiet, and you might need to put the mic a little closer.
That's me. I got my mic on now.
Thank you.
Robin. This looks great. Chargeback, that is institutional expenses that go to Fund 56 that we're charging back to the institutional fund. My understanding.
Correct. They're doing a journal entries to move those Winnebago expenses that were taken away from our allocations back to the placement fund. So as you can see in the blue table on the right, almost right across from that 59,000 number It shows as expenses in Fund 56. That means basically the transfers haven't happened yet, but are going to be.
Got it.
So yeah, the intent then is to make a process so we keep all of our allocations and the Winnebago expenses then are recorded in the placement funds.
Okay, so it's the negative revenue business that comes out of our allocation. You're saying we're actually we're taking funds from the placement fund to put into 56 to balance that. Is that?
They're basically doing sort of a chargeback process. So they are putting the expenses in Fund 54 and 44.
Awesome, thank you.
Yep.
Any other board members have any questions for Robin? All right, Tracy.
All right, so just to talk a little bit about our placements, you can see from the placement report in April, we had a fair number of adult institutional placements. Sorry, I've got to move too many things on my screen here. But because of the 2 months in February and March, we really had credits. So the overall total is not climbing like it might otherwise. The adult crisis stabilization, we're utilizing more. And again, the reason that we do that is to either use it as a step down when somebody does go into the institution, or sometimes it may also be an alternative way of diverting the need for an institutional placement. So the total expense for adult crisis stabilization is $25,926. The total expense to date through April, again, we don't have May in here yet, is $63,338. For adult community placements, you can see that has stayed steady with those 9 individuals in community placements. But I do want to draw your attention to that $111,841 reimbursement amount that you see. That's higher than the previous month's reimbursements. And that is because we are able now, with 4 months kind of under our belt, we're able to anticipate that CCS Medicaid revenue coming in to cover that very high cost placement. And so now we have made that adjustment to reflect that. So the total adult residential community placements through April is 171,359. So again, we started the year in Fund 54, which is the adult placement fund, with 482,278. We had a total of 260,623 in expenses through April, and that leaves 221,655 remaining in that fund. With child placements, you'll see that there's 1 less placement reflected in the child institutional, inpatient, and detention placements. I think we mentioned last month that we no longer have that youth in the juvenile detention. So you can see that that's reflected here. So child institutional expenses through April were $69,937. Detention expenses were $22,950. And unless we do see additional juvenile detention placements, we expect that to stay relatively the same. For child foster care and treatment foster care placements, that has stayed relatively steady throughout the year. We are through April with group home and treatment foster care expenses at $120,366, and regular foster care expenses at $9,024. So we started Fund 44, which is the child placement fund, at $527,341. Expenses through April are $222,278. And that leaves $305,063 in that fund for the time being. I do want to share with you, these reports are in your folders, just kind of what the comparisons look like. So here you can see the monthly comparison showing what the total monthly expenses of both Fund 44 and 54 combined are. So the dark blue bars here indicate 2021, and then the other bars indicate each of the previous years. So you can see that January we had an exceptionally high high month in placement expenses, and you can see how those have come down to that lower bar in April. But I do want to point out that we made that $111,000 adjustment, so that had we not done that, that would have reflected higher expenses for the month. And then just a comparison of how placements are trending. Currently, we are trending, if all of the expenses through April continued throughout the rest of the year, we would end the year at $1,408,703. That's our projection for the year-end balance of the placement funds. Now, there are some things that we're doing to try to mitigate some of that, some of the work that we're doing with the crisis stabilization and trying to utilize that more than institutional placements will be one factor that will mitigate it. All of the work that's done by the behavioral health staff in trying to utilize funded placements for community residential placements for adults, especially CCS, which is 100% funded. That also will hopefully help mitigate some of these expenses. I'll show you here with the breakdown of the different placement types. So you can see for adult, institutional, and inpatient expenses, right now, the projection is that we would end the year at $190,000. That's very low. I don't expect that. The reason that I don't expect that is we had 2 months where we had credits rather than expenses. And so I don't think this is very reflective of what the year will look like. Adult community placement expenses, when Miranda gave that presentation a couple of months ago on what's happening with getting Medicaid to pay for those, you can see how the trend from 2018 to 2020 continues down, and that's because we've been successful at getting those Medicaid funds to pay for those placements. It jumps up in 2021 because of that high cost placement, and we know that through that reconciliation process for CCS that we won't see the full benefit of those reimbursements until next year when we reconcile with the state. We are watching that pretty closely. We made that one adjustment of $111,000, and we'll be checking later in the year to see whether or not another adjustment could be made that would bring that down a little bit more. The crisis stabilization expenses, you can see how that is trending upward, and we want that. We want to utilize that more so that we can help transition people back into the community or avoid the need for an institutional placement. With the adult residential placements, you see relatively a steady expense. That's driven especially by that one Cholita placement that we've talked about over time. In juvenile detention expenses, like I said before, because that longer term detention expense ended, we do expect that to not trend up. It should stay relatively down somewhere around 28,000, 30,000 if we have just a few more detention expenses. Group treatment, group home and treatment foster care is trending up, and we have had some additional placements, so we are seeing a higher need with some of the families needing that level of care. And then regular foster care has stayed pretty steady. I think that's everything. Does anybody have any questions on any of that?
Is there a waiting list for CCS for community members getting onto CCS program?
I will ask if Miranda is available to answer that. I don't want to misspeak.
There is a to be served list, yes. When I get to the annual report, I'll talk about that, but that's where we'll work with individuals through other programs, crisis and outpatient, while we're waiting to get people into those programs.
And is that because of the lack of staff? Because you're down to staff?
I would certainly say that's a huge factor. Sorry, Miranda.
Yeah, no, that's right.
Because that, just to clarify, that program is 100% reimbursed by Medicaid.
Right. So there shouldn't be a barrier to us having, I mean, we can fund the number of staff needed for that program if we can recruit them. Right.
Any other questions on our placement report?
Mr. Chair, 2 questions. Tracy, on the first handout that you referenced, can you tell me the difference between, if I go down to the bottom of adult community residential placements, the difference between county expense 171,359 and total expense in Fund 54?
I'm sorry, Tim, do you mind just repeating that?
No problem. Yep. So after adult community residential placements, county expense 171,359, and then total expense Fund 54,260. Is that an aggregate of the top and the bottom?
That's correct. So
okay.
if you were to add the crisis stabilization, the adult institutional, and the adult residential, you should come to that 260,000.
Okay. And then second question, and if there's any identifiers and you can't answer, that's fine. Is the child that transitioned out of placement, did they transition to an adult placement or have they transitioned out?
Yeah, I believe, and we did mention this in a previous meeting, that you're talking about this chart here that's up behind me.
Yep.
So that blue represents that individual, and that individual moved to, I believe, probably one of these over here.
Got it.
So did not transition back to a family individual setting. Is that expense you'll see is one of the factors why these expenses are a little higher and those expenses were lower.
Okay, great, thanks.
Are there any other questions on our placement report? All right, let's move on to agenda item number 9, our contract monitoring report. So this is with Angie.
Yes.
Yeah, good morning. And Tracy will just get that up for you guys. There it is. Okay, so Tim, I believe you've seen this before a few times, so I need to explain the different categories, but what we're looking for on the far right side of percentage utilized is April bills, which is 33% and over. So most of the invoices we've received were through April. We've got a few on here still from March. So a couple of those are a little concerning that we haven't gotten billed timely, but I'm gonna focus mostly on the far right side percentage utilized column that's over 33%. So right away on the first page, first one is the Southwest Wisconsin Workforce Development Board. It's at 64% utilization. We will be talking about that a little later on the agenda to amend that. Right below that is the New Family Services, also over 33%. And that's one of them that's billed only through March. So we're gonna have to look a little closer at that one too, to see where we're at. A little further down is Cholita, which Tracy's mentioned a couple times. We're at 35%, but notice in the middle there, the current month invoice, they've invoiced us already through May. So we're not concerned. They're a little ahead in their billing usually. A little further down, Fond du Lac County Department of Social Services is at 62%. They've also billed us through May. And I do believe that is the last bill we will receive. So that contract should hold okay with the 49.5 that's been approved. And 2 up from the bottom is Positive Alternatives at 80, almost 84% utilization. While they have billed us through May, there's more utilization here in the future too. So we will be amending that a little later on the agenda as well. Page 2. Nothing to review it for that one. Everything is utilized under the 33%. Page 3. 4 or 5 down from the top is Premier Financial Management Services, and that's at 63% utilization. I'll be talking to Lori about what's going on with that one. As you all know, that's children's long-term support. And if you've been on the board for a while, almost every year we have to amend this one at least once or twice based on family utilization and need for that program. Everything else on that page looks good. So page 4, here, right at the top, Cornerstone Foundation, doing business as Lucky Star 3. Is at 45% utilization, and they've only billed us through March. So that was another one that I was a little concerned with this week, but I've talked to Miranda. She's feeling, looking at the projections, that should be sufficient at this time. Okay, and then everything else on that page looks okay. Page 5, right at the top is Cario. That is at 39% utilization, but I mention this one every month. They do invoice us early. So we have paid through May for that service. And the last page, number 6, Tolarian, just 3 down from the top. We're at 46% utilization. And we will just be watching that closely. I think Miranda's got that one on her radar as well.
I would mention that is crisis stabilization.
Any questions for me on the contract monitoring report?
No questions with the contract monitoring report. Let's move on to our next agenda item, number 10, approved contracts, amendments, and agreements.
Sorry, my phone's ringing. Let me hold on. There we go. Okay. Oh, it's going to continue to ring. Sorry. So there should be a summary sheet number 1. There it is. Referring to a couple of the ones right at the beginning were the ones from the contract monitoring report that we need to amend. These both are significant enough increases that we will need to go to county board for both of them. So Positive Alternatives is Jess. If you want to go ahead, Jess, and explain the situation there.
Yeah, so this is a youth who we anticipated would age out of foster care. However, with some of the COVID and pandemic exceptions, youth who are aging out have been given like some additional supports and services. So we are actually able to recoup the costs of continuing to allow this youth to go through our entire month of June and then possibly into September when the pandemic relief ends. So we're working with a transitional resource to support this youth to remain currently in the foster home until their independent living housing is available to them. So we did need to increase in order to potentially take us through the month of September. That total increase is represented here. However, our anticipation is that they would transition in July.
And the second one is the Southwest Wisconsin Workforce Development Board. And that is, we've talked about this one for a few months now. We originally projected 49.5 just because we didn't know exactly if that transition of leased to county staff, which was a large percentage of our individuals that are hired through the Southwest Wisconsin Workforce Development Board. When we found out that a lot of the COVID people were coming through here and we were adding more and more, I think we've added 5 funded through COVID. That's when we amended to 230,000. That was done in March. And then when we found out that the transition of leased to county was not going to be able to occur, that's 5 full-time with benefits individuals that need to be put on back or remain on the Southwest Wisconsin Workforce Development Board contract. So that increases this to $525,000 for those, all of the lease staff, which we have roughly 19, I believe, right now.
Any questions? Motion to appropriate to set these amended contracts on board for approval.
So
Motion by Timothy Gotchel for moving these amended contracts on to county board. One is Positive Alternatives Incorporated. The other one is Southwest Workforce Development Board, and seconded by Ingrid Glassbrenner. Is there any further discussion? Hearing none. Do you have discussion? No. Any discussion? All those in favor signify by saying aye.
Aye.
Aye. Those opposed say nay. Motion carried. Moving on to our next new contract.
Yeah, and just one new one this month that is called Forward Home for Boys. We have contracted with them in the past, just not for a few years. So Jess, did you want to explain that, what's going on there?
Yeah, so currently we have a youth who's placed in a group home, which is out of county. We're just looking to get this youth back closer to us. And there's now an opening in Forward Home for Boys. We are looking at transitioning a youth so that they can be back in our community.
Further discussion on this? A motion would be appropriate to approve this contract.
You can move.
Motion by Ingrid Glassbrenner. Is there a second? Seconded by Mrs. Chicker. Any further discussion? Hearing no discussion, all those in favor signify by saying aye.
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 Those opposed say nay. Motion carries. We're moving on to our next agenda item, number 11, personnel updates.
Mr. Chair, so we do have several updates to share with you. And again, with our new board members, I'm just going to remind you that.
I'm sorry, Tracy, your mic isn't working again.
I'll
Okay.
turn it on.
Okay, there we go.
Turn on my mic. I was busy coughing. There have been several personnel updates to share with you. These updates are no longer approved by the board because of changing over to the county administration, but we're informing you all of these. So Sharon Jones is a temp casual driver for the ADRC. She was hired effective May 26th. Deb Dittmer is an economic support specialist. She had transferred from admin to the economic support unit and has successfully completed her probationary period. And those are the changes for the current staff. We did experience 3 additional resignations since last month, which is pretty alarming. Katie Blaha, Child and Youth Services Case Manager, resigned effective the 4th of June. Tammy Newberry-Wheelock, Fiscal Specialist, actually transferred over to the clerk's office, so I think it's the county's benefit for that. Our loss, certainly. That was effective on the 8th of June. And Aubrey Bruckner, Economic Support Specialist, will be resigning on the 16th of the month. Also, Scott Hoffman, who is a leased rehabilitation worker with behavioral health, resigned effective the 1st of June. And we have rehired Liz Bjorklund as a mental health therapist to join behavioral health, and she'll be starting on the 16th. Those are all of the updates, but I do want to share with you the vacant positions. So I'm just going to share my screen for that. So as you can see, we have several vacant positions. This shows both our positions that we're actively recruiting for, and there are several positions that we've maintained on hold because there isn't funding to continue them right now. So in the ADRC, we are recruiting for one more driver. Behavioral health, we are recruiting for one psychiatric nurse, that new APS crisis professional position, 2 mental health therapist positions. In business and financial services, we are recruiting for a fiscal specialist. And in child and youth services, we are recruiting for 2 case managers. And economic support to replace Aubrey's position, 1 position we're recruiting for. The positions that are currently on hold include 2 admin positions, a clerical assistant and secretary, behavioral health, quality coordinator, early intervention special educator. You heard me mention that we're recruiting for a part-time position because this county position is full-time. We won't be filling this. We'll be using the leased position for that, as well as occupational therapist position and speech language pathologist are on hold. And in public health, there is 1 public health RN position that's currently on hold, and a health and wellness coordinator position on hold, and I think 1 nutrition site worker. So quite a few on hold as well. Are there any questions about any of that?
Tracy, on your, are you able to share any insights with exit surveys as far as the
more recent
the resignations?
I think so. Trying to think of how to speak about this. I don't want to disclose too much personal information, but I will tell you that wage was not the deciding factor for 2 out of the 3. One person is going to relocate. Well, a couple of people are relocating to a different area, and certainly with Tammy coming across the street, that certainly was a promotion. So that's a good thing. So we didn't see the same kind of feedback we were getting with those previous resignations. Oh, and Scott Hoffman, I would say that he was really kind of, he had started working for another organization and had indicated early on that it would be a matter of time when he would decide to leave.
Can I just note too that with all the vacancies, I'm concerned because I'm just not getting the applications. And we keep extending ads and running free ads, but there's still a few of them. We're still accepting applications through next Wednesday, but I've got 8, I think there's 8 total positions to fill, and I've barely gotten any qualified applications. That's concerning to me.
But you are getting applications. You are getting applications, just not qualified ones.
Well, for some positions, we've gotten applications, but we couldn't hire them because they don't meet the minimum requirement of qualifications. We have, I'll use the RN as an example. We can advertise and not get anything.
Diane?
So kind of on the same line then, I think Andrew kind of answered part of that question that we aren't getting applicants, but do we have people that we've offered the position to and then they didn't accept because of our wage scale?
Yes, and when I did that presentation last month, that was certainly one of the things where we have offered out RN and mental health therapists in particular. I think we've gone through the interview process and found good candidates, and I think they were hoping that there might be some flexibility on our part or ability to negotiate, and when they learned that that wasn't the case, they withdrew their applications.
I believe that our wage scale is being discussed at Finance and Personnel. Nothing's been brought forward to County Board at this time, but
I would like to thank this board for forwarding on that report that we did last month. I don't know what impact it had, but I do know that the Finance and Personnel Committee did decide to give as budget direction to the department heads to plan our budgets around aging the wage scale, which is one of the things that we were concerned about. So I think that's not a decision that will happen, that will be what happens in the end. But if we can plan our budgets around that, and if we can make it work, perhaps the board or the committee will see that that's what they can do.
any other questions on our personnel updates? And we'll move on to agenda item number 12, our quarterly review of Health and Human Services organizational chart. Tracy?
Thank you. I think I'll share my screen here, and I will ask Angie to walk through this org chart that she puts together. She's going to be able to highlight the changes much better than I can.
I'm sorry, I missed that. Are you guys ready for me?
Yes, thanks, Angie.
Okay, sorry. So yeah, this was compiled as of this week. So there's been some changes. If you want to go to the next, there we go. So this would be the administration and building operations unit, which is my unit. And you'll see first column, third person down, Veronica Olson is new. She was added as a confidential administrative secretary, largely working with the vaccine clinics, and she is leased. So she was one of those new positions now added into the Southwest Workforce Development Board contract. She started with us on April 5th. And then the second column, top row, Annalie Winter came back. She had started off a few years back as a leased employee for us part-time, and we've now brought her back, and she's our full-time main front desk secretary. Those are the only two changes from last time on that page. So I'm going to go to page 3. Yep. ADRC is here. The only change on this sheet was under the blue column transportation program. You'll see there's a vacancy still, but just up from that is Sharon Jones, which was the new hire recently as a driver. We're still looking to fill one of those. And the next page. Page 4 is behavioral health services, and lots of vacancies here you'll notice, which is concerning, but I'll only highlight the changes that have occurred, and that would be under the blue comprehensive community services block. The middle column down at the bottom, Liz Bjorklund is now looking to start. I left data hire off because at the time I did this report, I didn't know until just this morning that she is confirmed to start next Wednesday. So her block basically replaced Scott Hoffman's vacant block. And then if you go to the third column there that starts with Alice, if you notice right under Alice, I did add a block for Laura Radeska. She had resigned from the agency a month or so ago, and she is looking at coming back. But I left her date of hire blank as well. We do not have a firm date that she will be returning as a full-time Southwest Workforce Development Board employee, but we're excited she's coming back. That should be hopefully within the next month or so. And there we go, business and financial services. That's where that vacancy is, the third block on the right from Tammy's resignation or transfer. So we're looking to fill that position. Page 6 is the child and youth services, and we've got 2 vacancies now in that unit. You'll see in the middle row the 2 case managers. Those are both social work positions that we're looking to fill. And then you'll see just below in the lower, yeah, that vacant family pres worker is what we're now starting to get applications and do interviews for. It's through the Southwest Workforce Development Board, but it is also part-time. So while we have 2 vacancies for social workers, those are full-time. So we're hoping to get at least the family pres worker position filled soon. Page 7 is economic support. There's that vacancy on the top row, the 3rd one over, with Aubrey Bruckner leaving us in a few weeks. Actually, gosh, it's already next week. And then page 8, this is public health. No changes to the far right side, but the left side, that additional COVID pandemic assistance, I've updated that based on you know, people coming and going. You'll notice that we've added Veronica Olson, the 2nd block. She is doing a lot of that vaccine site coordination, which is really relieving a lot of the other staff that are listed on here needing to be at the sites. Unfortunately, largely because our numbers aren't very high, but she's at least able to take care of everything we need usually at the vaccine sites. So the 2 people, the far left is a lot of the actual public health focused employees that are been employed through the Southwest Wisconsin Workforce Development Board. Becky Dahl, Terry Landis, Terry Richards, those are nurses doing the on-site vaccines. And then the middle 2 columns are all people that are working, whether it's the testing site, the vaccine sites. The far right, the contract tracer column, they're unfortunately not having a need to use them much. I think they're able to take care of most of what they need done for contact tracing through the public health current staff. But I just made updates there and made some changes as where we stand right now as to who's working, helping out the pandemic response.
I would just point out, you'll see some names in those orange boxes of staff who are current staff in other positions. They are doing this work generally above and beyond their regular hours. So they're either accruing comp time or getting paid overtime depending on what their status is. So they're not reassigned, they're doing extra hours of work. And like Angie said, we're seeing some of less need for that as there is less contact tracing work to be done. That's good. On the not so good sign, we aren't giving as many vaccines right now.
And that's all I have. Any questions on any of those?
No questions. No questions. I guess we'll move on our agenda to agenda item number 13, a review of our 2020 annual report. Everybody should have brought their packets. I was rushing today and didn't grab mine.
Might have one for you.
There was one available over there by Jason. I looked at earlier in the week.
So thank you, Mr. Chair. As you know, every year we compile program and statistical information related to health and human services to kind of show how we end the year, what services were provided, what was significant about the year. I do want to thank all of our management staff and administrative staff who have put this together. It's certainly no small feat to put all of the information together, compile the numbers, and actually physically compile the booklet. It's all done in-house. Special thanks to Megan, who puts it all together, both takes all the information and makes it organized, and then actually physically puts it together. It was a very unusual year last year with the pandemic. We were fortunate to have some very competent and skilled staff help us respond to that. 2020 will be known as the contact tracing portion of dealing with the pandemic, and hopefully 2021 will be known as the vaccination and recovery period of the pandemic. I think generally what we try to do is step through the different sections and give the management staff an opportunity to share some of the highlights. And then the board can certainly ask any questions at those times. So I think we probably start with public health. I don't know if Rose is still able to be here. Oh, yeah, I see Rose is here.
Yes. 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 Thank you. And I put a short forward on my section just because of the impact that COVID-19 had had during our unit's operations during the calendar year of 2020. You will see from the data that has been collected that overall there has been a reduction in many of the services that we have normally provided. However, you'll see that there are some areas where we maybe saw more activity, surprisingly. Overall, if we look at immunizations, those were down. And of course, we weren't able to hold our usual number of in-house childhood immunization clinics. So that would account for a good part of that. I am happy that we were able to provide over 600 influenza vaccines. Many of those occurred in school settings. However, we did change our concept of operations and actually provided a fair amount at the fairgrounds from, I believe it was September through November. So we used a drive-through model, which actually worked quite well. And our staff got quite skilled at providing vaccines in that fashion. As you can well imagine, with communicable disease surveillance, the coronavirus testing and the lab reports that we received were considerable. And I just want to mention that when we see the amount of COVID-19 tests that were recorded in 2020, it seems like an extraordinarily high amount. In fact, it exceeds the numbers that we normally report. And the reason for that is that's the raw data when it comes to the numbers of tests. It's not the numbers of individuals who've been tested, it's the numbers of tests that we received in through our Wisconsin Emergency Disease Wisconsin Electronic Disease Surveillance System. So many folks were tested on serial occasions. So we'd have some folks who've been tested 10, 12 times. However, prior to October, we followed up on every test, regardless if it was negative, positive, or inconclusive. So through the vast majority of the year, we touched each of these for the most part. In October, the state had a different system that they put in place where some of it was booked or benchmarked or set aside, and we didn't have to touch them. However, we still see them, and oftentimes we do have to look at them in part. We don't have to do as much with negative tests as we had done earlier. However, the vast majority of this 8,962 tests were touched by public health. And you'll see that we did have one reinfection that was listed as well during the year of 2020. Surprisingly, or maybe not surprisingly, despite the fact that folks should stay at home and socially distance, we did have an uptick in a couple of our STIs. And we also had an increase in our influenza hospitalizations. We don't react or respond to tests that come in. We actually do investigations on folks that are hospitalized. So we did have an uptick in that as well. Otherwise, not too much otherwise going on with communicable disease surveillance. Our TB skin tests were down, and we did switch to a model whereby we were administering those car side in our parking lot for a period of time. And so that allowed us to at least see over 100 folks. We did 110. We had an average year for bites as far as animal bites go. We had 36 animal bites that we fully investigated, and there were 12 cases where the public health office provided payment for testing, and it's called fee-exempt testing. There are some situations where a person does not have exposure to an animal. It can be potential. I mean, it could be actual. For example, you wake up and there's a bat flying in your bedroom. You don't know whether you were bitten or not. Many people who are bitten by bats don't even realize it just because of how fine their teeth are. But if you do awaken, either you or a family member, and you find a bat in your home, and you're able to collect that bat, and you can get it to be tested, we'll pay for the testing. We don't pay for the euthanasia or the packaging or the transport, but we take care of that testing. And so those 12 cases were those that public health responded to when we had concerns. Bats aren't the only thing that folks are exposed to, of course, that aren't part of our usual animal bite protocol, but we did have 12 instances of that. Our at-home services, such as maternal child health and prenatal care coordination, were down just because we weren't getting referrals, and also folks weren't that comfortable with having us come to their homes, but we were able to see at least 3 individuals during calendar year 2020 for maternal child health visits. Let's see here. We try to keep our loan closet going regardless of having our building closed. We understand that there are definitely needs for folks who are at their homes so that they can remain independent, or for those who are being discharged from acute care stays, or for those who are returning home from a long-term care facility. So we were able to allow 167 individuals to borrow 217 pieces of equipment. Our Well Woman program is one that is, we're part of a consortia of several counties, and Juneau County takes the lead. So they did continue to enroll women from Richland County, and you can see the stats on that as well. Betsy Raisler actually took the lead for a maternal child health priority, which we received funding for. It had a focus of adolescent suicide prevention. And you'll see a metric which shows all the different efforts that she worked on in support of that particular initiative. And she's very adept at what she does. We're very grateful and thankful for her ability to mobilize coalitions and to move forward the initiatives that we hope that she'd do as a result of that funding for that particular focus area. We also have a tobacco control in Wisconsin Wins program that is also, we're part of a consortia for that, and Juneau County is the fiscal agent for that as well. There weren't any inspections of retailers who have licenses to sell tobacco products at all in 2020. However, they did an enhanced program of providing education and support to retailers. You'll find with environmental health, it was more or less an average year. Troy Morris, our environmental health coordinator, remained busy regardless of COVID-19. He did not necessarily see as many folks in their homes, or he abbreviated those visits to reduce that amount of time of face-to-face contact, even though we would be masked in that but he didn't. We saw a fewer folks in their homes. However, we still had definite numbers of cases. So not much has changed from year to year on that as far as the environmental health statistics go. For child-led poisoning, that was a bit different. With WIC not operating, they are the vast contributor of child blood-led data that we receive. And since they are still not providing in face-to-face contact, there was a drastic reduction in the numbers of children who were screened through WIC, and even at their healthcare providers for childhood poisoning prevention visits. And let's see here, and you'll see with preparedness and response, we definitely were able to move beyond exercising these objectives this year. We actually implemented them. And you'll find that there were several preparedness capabilities that were expected for calendar year 2020. And those are indicated here too. You can take a look at those at your leisure. Nutrition, you'll find that with nutrition, we pivoted to 2 different types of meal delivery. Primarily, we did bulk frozen meals to folks in their homes. And depending on the capacity, they had to store the frozen meals. Some folks would receive 2 weeks at a time. Sometimes folks receive less. And then we tried to reinstitute a hot option, and folks were allowed to pick up hot meals at the campus. They would actually be put in like a carry-out container, so folks they called it grab and go. And that's still occurring. However, the expectation is that we will move back to our congregate and our home delivered types of our methods or mechanism for providing meals to folks. So I'll have you take a look at that as well. Of course, you can see the home delivered went up considerably during 2020. But overall, some of the meals served actually were increased. So just will bring your attention to that as well. So I hate to be in such a rush, but I do have to prepare for a clinic outside of our office. So if you have questions, please feel free to let me know. I'm happy to provide information as you wish.
Mr. Chair, I think building operations or administration building operations is next in the section. Angie can speak to that.
Would anybody like a break first before we continue on? Feel free to get up and go if you need to use the restroom or grab a glass of water or something.
Excuse me, Angie and Robin, I think we've got that combined together, even though we broke those two units apart.
Okay, so the first section, page 33, is where I'm at. So this just talks about how administrative services unit was split into two units, the administration and building operations, and then the business and financial services unit in August of 2020. It divided the unit, but it offered clarity too regarding supervisory responsibilities, structure and focus. It gave us those things that we needed as well. And just looking at, you know, the duties listed below on that first page, 33, those are split up amongst our two different units. And we still obviously work together a lot and cross over to accomplish any tasks we have. So just going to the next page, 34, we are really, 2020 was a lot about COVID, as we all know. So admin and building operations and also Robin's unit, we did tap into all staff. It was kind of all hands on deck at that time in March of 2020. And one of the areas of responsibility that was kind of new and assumed was I started the public information officer role that started on March 17th and is now ongoing. Back then, I was attending one or two different EOC briefings a week, typing noting all the after action information and preparing press releases. So in the year of 2020, 137 press releases I sent out, as well as 7 additional press releases for Health and Human Services specific. Lots of connections and in contacts with local newspapers and updating the webpage, Facebook pages, all that kind of thing as we pursued ways to notify the public. It was a very interesting time because we hadn't really done much of that. So our Facebook page, we had just started like maybe the year before. So, but we didn't really have many followers. And so as COVID progressed, that was a very informative piece of social media that we started to use. So COVID testing was a lot of what our staff would do. From September to March actually of this year, we had 4 different admin staff and 3 economic support staff that would rotate and work 6 hours every Monday at the Richland County Fairgrounds. Whether it was hot, cold, rainy, snowing, we did have some cancellations in February due to extreme temperatures, but they put on the full PPE and went out there and helped assist the Richland County Emergency Management. So there's a picture of them there. I'm just going to jump over to 35 then, and page 35, and largely our accomplishments had to do with the pandemic response. A lot of what we do normally kind of took a back seat, just like Rose said. We put things aside. We're trying to catch up with tasks this year that were targeted for completion last year. So really, hopefully the public health pandemic response is definitely starting to lighten up this year. So that's good. So hopefully we can achieve some of the goals that we have for ourselves in 2021, which is listed below. And that is some emergency response work as well that we hadn't finished about shelters and opening shelters and what that would look like. And then we did take care of restructuring and relocation of file room 1 and file room 2. That took about 3 months of work to get that all done. And then we are continuing to study the EHR system known as Cario. So that's goals that we have for this year. And then Robin, you have page 36.
Okay. Can you all hear me? Good. Okay, so page 36. Our focus this last year, we were also involved in the pandemic response, and the fiscal side of things was making sure that we're adequately capturing different sources of funding from the state and whatnot related to the pandemic response. I think if I had to guess, there were maybe 5 different sources of funding, and we have even more grants now. So just keeping track of all those has been making sure we're not overclaiming and making sure we're capturing all our revenue has been one of our duties this year. And to help that, we actually, for another program, our CCS program, or WIMCR programs, I should say, one of the requirements was that we have a time tracking software. We got that up and going this last year, so all staff now are basically putting their time that they work into a software program and breaking it down by the programs they work in. So we're able to capture different fundings based on how they spend their time. So I think those are a couple of the two notable things that this unit did this year, and the rest I guess you can just read.
The chair, moving along the ADRC section, Roxanne would be talking about.
Okay, so the first page talks about our mission statement and who we serve. The notable thing on here is that even with the pandemic, we still served, we processed 15,061 incoming contacts between our programs. So, and with the changes, of course, we had to look at different ways of doing things. So ADRC staff provided limited in-person services in 2020, but we were instead able to do things over the phone, via Zoom, and through the mail. So our key areas of activity would be our information, referral assistance, and options counseling. So this is one of the core services that our information and assistance specialists provide. So in 2020, even with the pandemic, our INA staff received 5,348 contacts from consumers in our county. Of those, 58% were 60 years and older, 22% were people with physical disabilities, 5% were customers with developmental disabilities, and then 15% were customers with mental health and substance use disorders. Let's see. So, and then also consistent with previous years, about 79% of the needs expressed fell into 4 broad categories. So financial assistance and support, long-term care programs, health, home health, home health supportive care, and housing residential needs. And then we also are the entry point for publicly funded long-term programs. So in 2020, we did do 77 functional screens and enrolled 69 individuals into long-term care programs. Our disability benefit specialists, like our other staff, our INA, were able to meet with people via Zoom and over the phone. It amazed me last year just at how all of the staff were able to continue to provide services, and they just very quickly adapted to the new way of doing business when we were not able to see people face to face. In 2020, the Disability Benefit Specialist Program assisted 138 Richland County residents in receiving over $553,000 in federal, state, or private benefits for which they qualified. This is significantly less than 2020, just due to the pandemic. But since 2002, since the state has been keeping track of this, the Disability Benefit Specialist Program has had a monetary impact to Richland County of $16,262,011. Our Elder Benefit Specialist Program, that is Joanne Welsh. She works with people who are over the age of 60 and helps them, kind of like what Jody does, helps them with applying for benefits, applying for disability, Social Security, retirement, helping them get through any kind of red tape that they have related to their benefits, and also help with appeals and so forth. In 2020, she still saw 330 people, or provided services to 330 people, and her total monetary impact was over 1.6 million for the county, for residents in our county. We continued to offer early intervention and prevention services. Of course, because of the pandemic, it was much less in 2020. And so our numbers were quite a bit less, but that has started back up. So we did have 3 Tai Chi classes and 1 Strong Bodies class. The Strong Bodies class was actually later in the year, and one of the Tai Chi classes was later in the year as well. We were able to provide those and be socially distanced, wearing masks, and do those in a safe manner. We also provided our first Powerful Tools for Caregivers class in partnership with a regional dementia care specialist, and we had 8 individuals take that. As years past, we've also had transition services for youth. This is assisting our youth that are in high school that have disabilities, transitioning them into the adult world for benefits and for services. And so we continue to offer that as well. So we provide information assistance to the teachers who are making requests on behalf of the students via email, telephone, and last year we were only able to do, of course, in-person meetings the first part of the year. And then we also provide specialized options counseling to youth and their families. We're a part of the monthly County Communities on Transitioning, which is called CCOT meetings, and we continue to do that. And then ongoing outreach to the schools. Another program that we provide within the EDRC is the Alzheimer's Family Caregiver Support Program. So in 2020, we received a total of $4,027 for this program, and the funding was provided to provide information, assistance, and supportive services to Richland County families, and then conduct outreach and education to the community. This was significantly less than the year before. Again, you know, I hate to keep saying it's because of the pandemic, but it seems like everything's because of the pandemic. It's just changed a lot of the way our services were last year. So we didn't do nearly as much outreach or in-person kind of activities, of course, and so we just didn't expend as much of our allocation that we had. We do also, through the region, have the Dementia Care Specialist program. And our Dementia Care Specialist was really a huge part of us continuing to provide our support groups. So our Dementia Care Specialist helps people assist families and individuals with dementia to continue to be active in their community and remain in their homes for as long as they're able. So she does individual consultations. She provides Dementia Live, which we did do that in the beginning of the year. We provided Dementia Live to local law enforcement, also did dementia capable training to our local law enforcement at the beginning of last year as well. And then we also had a virtual caregiver boot camp last year. A total of 21 people attended this event, and it was held every Monday in November and had different topics each week. And then our Richland County Transportation Program, we did slow down our services quite a bit at the beginning of the pandemic, and we only provided trips to like dialysis, radiation, chemotherapy, only medically necessary appointments. So we did that through April, May, and June. And since then, things have really picked up again. So in 2020, our trips were down for our bus program and our driver escort program, but they still did provide quite a few trips. So our public transportation and lift vehicle, they had 3 temporary casual drivers, which provided 701 trips going 13,184 miles. And then our driver escort program, we had 19 volunteer drivers, which is significantly less than what we've had in the past. And they provided a total of 3,417 one-way trips. They provided 134,206 miles, and they donated 6,491 hours of their time. And then our National Family Caregiver Support Program, we received last year $15,237 for this program, and we used that funding to provide information to caregivers about services, to give assistance in gaining access to support services, individual counseling, advice on organization of support groups, respite care, and then supplemental services as well. So a total of 19 local families were provided with respite services or supplemental services. And that's all I've got for the EDRC.
And then Jessica Stanek would speak to the Child and Youth Services Unit.
Yeah, so the first page is just to kind of lays out our layout, which Angie talked about in the organizational chart earlier, fairly closely, other than we did have a change this year. So that's not noted in this last year's with the supervisor position. But the 4 programs we provide for our child protective services, youth justice, foster care, and kinship care, which is our placement resources, and then independent living. The next page and a half or so is just the child welfare model for practice that is implemented in the state of Wisconsin. Just thought that keeping that in there kind of helps people know kind of what it drives the child and youth services programming. Our numbers for 2020 is child abuse and neglect reports. We received 213 reports with 317 alleged victims. 62 of those reports warranted enough for us to complete an initial assessment. We received an additional 100 reports of child welfare, which could just be families or people reaching out for services, and 62 of those cases were open. I would note that both types of reports, we were probably down about 30 reports for both child protective services and child welfare reports from the year prior. We did have a pretty big lull for a period of time during COVID, especially when the schools were shut down, which is our primary source of mandated reporting during the school year. Our youth justice referrals, on the other hand, were up. And we would note that those referrals also were primarily related to a lot of inappropriate communications on electronics devices, both school devices as well as personal devices, and less personal crimes, such as against a body, a person, or in a school setting. So that was just an interesting part of the COVID pandemic. I think that was seen fairly regularly across the state. Our team has been undergoing some trainings for the Yazi Tool, which is a youth assessment screening instrument. This is a statewide implementation that is occurring, and it's an evidence-based practice for screening youth to determine their risk level for reoffense and what types of services would be best fit for them. So we're really excited about implementation of this because it takes away the blanket court-ordered conditions, but really tailors to meeting the needs of the family and the child specifically with those youth justice populations. Our YES program, foster care and kinship, have maintained relatively status quo. I think the biggest impact on us would be noticed on page 20 or page 50, rather, just regarding our implementation of services during the COVID pandemic. We did a lot more individual-based services. Our YES youth empowerment services usually runs several in-person groups per year. And we had to do some modifications just because of guidance and those types of things to do a lot of those more individually based. But we have also been trying to be creative on how do we get youth and families involved, kind of helping youth be creative in finding opportunities for community services and those types of things, still utilizing the incentives and rewards that we utilize in that program to ensure their cooperation and compliance with them as well. So we do still see that there's a positive impact of whether we're doing this individually or on a group basis, that it does reduce the amount of referrals we receive on those youth that we are serving at that period of time, as well as in the 6 months after their involvement in the Youth Empowerment Services program. That would be all the updates for Child and Youth Services.
And Miranda Culver would cover behavioral health.
Good afternoon. I was going to say good morning. For behavioral health during 2020, we served 483 individuals. That was down about 75 people from 2019. And the pandemic certainly impacted our unit as well. And we did our best to really focus on continuing to get those services out to individuals. We're fortunate to already have Zoom set up with our outpatient psychiatric department. And then we also used phone contacts, and for individuals who couldn't get services any other way, and we did have providers continue to go into homes with protective measures in place. Our crisis intervention services continued throughout 2020 with Northwest Connections being our after hours and daytime primary call-in emergency telephone services for individuals in need of crisis services. In 2020, you'll see there on page 53 that we did have a pretty significant increase in crisis contacts. The crisis services were provided to a total of 214 individuals for a total of 2,885 crisis incidents during office hours and 484 after hours calls that came into Northwest Connections. A couple things occurred during 2020 that we think accounted for the increase. First, we had that dedicated crisis linkage and follow-up staff for the entire calendar year. And if you look back during some previous years, we didn't always have a dedicated staff. We also think how that staff counted each contact. So if they had 5 linkage and follow-up contacts with an individual over the course of the day, they counted those as 5 separate contacts, where previous staff may have counted those 5 contacts as 1 daily contact. So we think that accounted for the increase. In addition, we continued with our crisis and outpatient mental health worker in the school system during 2020, and that accounted for 25% of the individual crisis contacts. And then another statistic we've started tracking, we do believe there's been an increase in those crisis contacts due to substance use disorders or substance use related concerns. So 44% of all crisis contacts during 2020 were for consumers struggling with those substance abuse related concerns. During 2020, there were a total of 33 emergency detentions or emergency hospitalizations. 11 of those occurred during office hours and 22 of those occurred after office hours. And then our inpatient psychiatric funding. So those would be funds that we use for individuals that go to hospitals other than Winnebago or Mendota that do not have health insurance coverage and would go on an emergency detention. So we have contracts for those hospitals through Gunderson Lutheran, Mayo Health Systems, Southwest, and Southwest Health Center. We paid for 0 days. Most people are insured that are going to those hospitals for emergency detentions, and they are able to bill Medicaid and Medicare and then other major insurance programs. And, going to page 56, you'll see the number of days in mental health institutes. Last year, we did have quite a high number of days, 731 days for a total of 26 clients or patients. Our acuity overall during 2020 was quite high. It was quite a significant crisis year and need for institutional use. The pandemic did play into some of that. We did have some people get exposures and as well get COVID while they were in the institutes that were delayed in being released, as well releasing placements that we would typically use had delays and sometimes lockdowns. So certainly the pandemic played into that and made it a much more challenging year. And for a time last year, I will note some of the other private hospitals that we use were on diversion and just not taking those 51 ED or emergency detentions. And then we also continued to use during 2020 the Institutes for Mental Disease. Trempealeau County Healthcare Center was the institution that we used. Some years we did not have individuals go there. Last year we did utilize Trempealeau for 3 clients that were placed for a total of 282 days. And as I discussed, our outpatient clinic continued to run during 2020. The psychotherapy was provided to 31 individuals, and then psychiatric care and medication management was provided to 71 individuals. We continued to have psychological evaluations, although some of those do need to be done in person. So that number was a little bit lower until we were able to resume in-person services. During certain points in the year, and there were 15 psychological evaluations completed during 2020. The number of unduplicated mental health outpatient clients during 2020 was 105. And then, like I talked about, we continue to have the outpatient mental health worker embedded in the Richland school system. And she provided services to a total of 58 youth, virtually and in person throughout the pandemic. Our substance abuse treatment services.
Excuse me, Miranda, I think there's a question here.
Oh, sure, okay.
And Miranda, it's curious. So in the number of outpatient mental health clients from 2014 to 2020, there's a significant drop, especially in 16. When I first got on Health and Human Services Board, we had this crises that was going on. What is the difference now from 16 to 2020 in that reduction that we have? Like what's leading to that? Which is good.
So there are some strengths in their community. We have had some additional outpatient providers open for private practice. So that's another option for folks. But I do think that we are reduced in the number of outpatient therapists. I don't know if you remember back from 2020, we did have in our budget an option to hire an additional outpatient therapist, but that position was unable to be recruited. So from 2016 to 2020, I believe, I'd have to pull the org chart, but I believe we had either 3 or 4 outpatient therapists running at a full-time capacity. And we really only had 1 running at a full-time capacity during 2020.
So what was happening before, the way I gather it was that we didn't have these therapists before, and now we did have them, which reduced the number of people needing to be institutionalized. The other way around.
So if I'm understanding you right, if we have more mental health services available in the community, it's not a guarantee that it's just a direct correlation, but generally you have the less need for more hospitalizations or institutional placements. So if we have more services here that people can access, hopefully we can prevent those things from happening.
So that could relate to the 731 inpatient days in the mental health institute compared to the 279.
It certainly can be a factor, although I have to really caution us to look at too that if we have an individual who just happens to have very significant mental illness and requires that, having community services won't impact that. So it's important to kind of look at those individual factors in addition to, do we have enough community resources to help prevent that need? And I'm sorry, I'm probably jumping in. Miranda and I both have that mental health background, so I jump in on these a lot more often. Is there anything you'd like to add, Miranda?
No, that's correct. And yeah, I guess I would just add that 2020, there were a lot of very sick individuals that the reason for increase in days, perhaps more staff would have helped, but sometimes those lengthier hospitalizations is really just getting at reducing symptoms such as psychosis, so people can be stable and safe in the community.
I think one of our goals as we've been trying to develop our budgets is to rebuild some of those mental health services. And we certainly have hit this kind of a wall with our recruiting because we haven't been successful at recruiting those individuals, even though we do have the funding for it.
I was just going to say the earlier intervention could help to, I don't want to say prevent the psychosis, but it could certainly help with identification.
I'm sorry, I couldn't hear quite what was said.
I was saying that with staff intervention, sometimes it can help to maybe not prevent psychosis, but earlier treatment can help maybe deter some of those long-term patients.
Oh, it's not working.
Third time's a charm, is that?
There you go. Yeah, that's better.
I was just saying that, I can remember what I was saying. you know, when you have earlier interventions in someone who, you know, develops psychosis, that it can, if you can start treatment earlier, that it could prevent or shorten maybe some of the stays, the inpatient stays that they have.
Yeah, absolutely. Yeah, getting those positions filled and having more staff is certainly would help. We would think. Any other questions, or should I move on with the substance abuse treatment services?
You can move on.
Okay. So in 2020, again, we continued to do virtual, some limited in-person and phone contacts with outpatient substance abuse treatment services. We actually had more than one outpatient substance abuse treatment staff and served a total of 86 individuals. Also continued with working with our intoxicated driver program. So each individual in Wisconsin who is convicted of either a citation or a criminal charge related to driving under the influence has to come into their designated agency within the county for an IDP assessment. And then they, after an assessment, will go on to either education or treatment. And then a total of 78 individuals were served last year. And likewise, our Choices program that uses the Prime for Life curriculum works with youth or anyone under the age of 21 who receives a citation for using alcohol has to come to that program. We only served one person last year. And just really the requests for those courses were down. We are finding as a result, our numbers and the requests for classes have been quite increased so far this calendar year. So we do think maybe the pandemic, our agency being closed, that maybe just as many people weren't getting citations or weren't following through with that requirement. And then our sobriety court serves individuals with 3 or more OWI convictions. This court is specific to alcohol dependence issues. It's a 5-phase, 14-month minimum program. And during 2020, there were 15 individuals served, which that program is designated to cap at about 15 to 16 individuals. 2019 had a little larger number because there were quite a few graduations, but I'm right on target with the number of individuals we served in that program. Our comprehensive community services program is a psychosocial rehabilitation benefit provided to individuals diagnosed with mental illness or substance use disorder. During 2020, actually exactly the same numbers, not necessarily the same individuals, but exactly the same numbers as 2019, which was interesting. 34 children and 27 adults were served. I want to highlight that program specifically. We do have service facilitators, and I know there was a little discussion earlier about a to be served list. Certainly we don't ever want that as a Medicaid fully funded benefit. Throughout COVID, it was really important. A lot of those individuals being in that program get daily service, sometimes 2 or 3 times a day of services. So we have our facilitators and therapists on staff that work with that program as well. 2020, we had 75 individual contracted providers, not necessarily individual agencies, but 75 individual providers that continue to go into homes with that protective equipment. And I can imagine without them, both our children's placements would have been increased, and while adult placements didn't look great, I know their work really helped stabilize and keep some individuals able to keep getting services in the community. Our Coordinated Services Team Initiative is a wraparound services team program that works with children and families. The goal of the Coordinated Services Team is to really work with families and get at the table natural supports to allow those children in need of services to have services in the community, keep those children in their homes, and eventually the goal would be to not need the CST program and let those natural supports really work and support the family. Again, 33 children were enrolled in that program. And that program runs right alongside oftentimes with our CCS program. Then the Birth to 3 program, again, is an early intervention program for children ages birth to 3 that reside in Richland County. The child must show a 25% delay in one or more of the key developmental areas, either social, emotional, physical, cognitive, adaptive, or communicative. In 2020, there were 34 referrals to the Birth to 3 program. I will say those numbers were a little bit more trending downward, and we do believe also a lot of the time those referrals come from physicians in the community, and we do think that number was down just because of the pandemic as well. And then 48 children were served in 2020. In addition, our children's long-term support waiver programs and children's community options programs work with supporting the needs of families that have a child or children with diagnosed severe developmental, physical, or emotional disabilities. In 2020, 42 children were served in both the waiver and the CCAP programs. I'll talk a little bit about, sorry, my phone is gonna ring. I'll talk a little bit about detox services. Detox services are court-ordered or court-mandated services. They're rather 5145 mandated services for individuals under the influence of alcohol that is causing them to be a danger to themselves or others. In 2020, we had increased the number of days in detox, 16 days for those legally mandated detox services, and 6 clients utilized those services. So that was up a little bit from the year before. Then our mental health residential services. Mental health residential services are utilized for individuals either stepping down from an inpatient psychiatric unit or due to their substance use or mental health related disorder, they're not able to safely remain in the community. All of those individuals are either under a guardianship and protective placement or under a court-ordered commitment. In 2020, 14 individuals were in those placements for a total of 2,217 days. And that's where CCS services ran right along with many of those individuals in those placements to assist with the psychosocial rehabilitation model to be used right in the residential services, as well as it certainly acts as a funding source. And then Adult Protective Services is a system designed to protect Richland County's vulnerable adults that are age 18 and over. During 2020, the Elder Abuse and Adults at Risk funds that are designated to work with that program served a total of 12 county residents. 2020 also saw an increase in financial exploitation cases that were reported for elder abuse or elders at risk. The total recorded dollar amount was quite high during financial exploitation cases during 2020, and we're seeing that continue in 2021 for over $1 million in financial exploitation cases. And I think actually next week on the 15th, there'll be some information on WRCO additionally shared by law enforcement and our APS team related to that. And then our Adult Protective Services court actions. In 2020, 29 court actions were completed for 22 people. This includes our guardianship process, as well as guardianships and protective placement reviews or reviews of individuals in those court-ordered placements. And then 55 people had annual protective placement reviews. So that's the worker being sure that they're still placed in the least restrictive setting under those protective placements with guardianships. Any questions about any of those other services?
I have a question, Miranda. This is Cindy Chicker. Regarding detox services, the description only covers alcohol detox. Any issues in the area with drug detox, or maybe I missed where they were covered?
Drug detox, is not typically covered under the 5145. It certainly can, but oftentimes those individuals will be detoxed in a different setting. The 5145 code, I believe, focuses more on alcohol.
Thank you.
If there are no other questions, Stephanie Ronfeld can speak to the economic support services.
Sure. So when you get to our section, economic support, we start off with our mission statement, which is really pretty simple. It's just that we're there to provide services to people in need of whatever it is they need to achieve economic stability. Almost 20% of the Richland County residents are on some form of assistance, public assistance. And if they're not eligible for our programs, we definitely try to do what we can to put them in touch with other resources. 2020, I'm probably saying the same thing as everybody else, was an interesting year. But really for us, a lot of what we do was also already done either through phone or internet, things like that. So not a lot of change in how we provided our services. Our call center remained really busy. We are still part of the Capital Consortium, which is 8 counties in the state that come together to help the residents of all those counties. For the, in 2020, we took fewer phone calls in 2020, believe it or not, but that is as a result of some of the COVID policies that changed. For example, individuals don't have to do interviews for food share, so they didn't need to call us. They could just go online, do their renewal, and we would take care of it. We didn't have to actually have them call us. So our phone calls were actually down. Although our Richland County Economic Support Specialist still handled over 20,000 or almost 20,000 phone calls. As far as applications for Badger Care, Medicaid, food share, those were actually up, which would make sense as families struggled with loss of jobs and things like that in 2020. We actually processed as a consortia over 80,000 applications of one of these programs, with Richland County Economic Support Specialists processing 6,500 of those, which is almost 1,000 application increase from the prior year. So that was just the overall numbers of phone calls and applications that we handled. The details of it for each program for Badger Care Plus, you can see it on page 67 in 2020. We have over 11, that number increased by quite a bit as we enrolled over 11,000 individuals. Granted, that's not all Richland County residents, but it just tells you the workload trying to help families get on some sort of health insurance, obviously due to job losses and whatnot. A new number that I was able to track down this year, I had it in years past and the report disappeared from me, but it showed up this year. When you have individuals on Medicaid or Badger Care, including long-term care programs such as nursing home, it's an interesting number to show the economic impact to the county with $36 million in funds that would have come into different healthcare providers in the county for services provided. Caretaker Supplement is a program, page 68. Caretaker Supplement is a program for families that are on SSI. It's a supplement to help them if they have children in the home, to help with that. So we were able to help 19 children families receive additional assistance to help them financially. Childcare assistance, we've mentioned that. It's been brought up on several occasions throughout the year, and Tracy just mentioned it earlier. That number is going down. In 2020, we only paid out a little over $15,000 to providers on behalf of families. That was down from $25,000 in 2019. And again, that's because of the lack of providers in the county. So hopefully 2021 we'll see that move up again as we work to increase the number of providers in the county. Food share recipients, we really, we went up about 3,000 unduplicated recipients in Richland County. 300 recipients, that's enough. But what you'll probably see there at the bottom of page 69 is that the number of total benefits paid, as you can see, it's pretty much an extra $2 million went out in food share benefits to individuals and families. What they did in 2020 as a result of COVID was they issued for almost all the months, obviously except January, February, I believe March, and then I think June we didn't issue, but what was called emergency supplemental food share. So every family was brought up to a full allotment, and it didn't matter how much their income was or anything like that. These families were brought up to these full allotments. And so that would be why there was an additional $2 million in benefits paid out in totals for a total of $4.2 million. Fraud and front-end investigations, those did happen, but honestly, we don't have a lot of fraud referrals that happen. And then also in 2020, we did not have what we get we get these quarterly wage matches that we would have to monitor and investigate, usually as a result of people not reporting changes in their income. And in 2020, I didn't put this in there, but in 2020, we didn't have those matches come through. So there wasn't a lot of need to investigate. So not a lot of fraud discovered. Marketplace in 2020 they had, that was 2021, so maybe I'll see that on next year's report. Again, medical assistance, that's so Badger Care is for families with children and for caretakers of children. Medicaid is for the disabled elderly. That's our long-term care programs. And we saw a slight increase in the number of individuals enrolled in that program as well. Energy assistance, we did see an increase in energy assistance. I'm all the way at the end here on page 72. A slight increase of almost 40 households. Benefits were about the same, but again, that was due to more families asking for help this year. And there was a lot of funding available, not only for regular initial benefits, but for crisis benefits. Still lots of benefits out there for that program. In 2020, we had additional families ask for help in those programs as well. Any questions? Great, thank you.
And Mr. Chair, I think Robin can speak to the last section related to the fiscal unaudited figures.
All right, as Tracy just mentioned, it's unaudited. At this point, we're still waiting for final numbers from the auditors. So take that for just a side note. So our total revenue in 2020, this includes, this first table is our core budget and the placement fund. So this is what the picture looks like with everything combined. So the total actual revenue was a little over 8 million. The total agency expenses, as you can see, were about 6.4. Total placement with our high year was 1.7. leaving a negative total balance of $110,079. And because we don't have the final numbers from the auditors, and the county hasn't yet determined how that's going to be covered. Moving on to page 74. This table just gives a little description of where all of our funding comes from. I think last time I looked, we had over, I want to say 150 some different revenue sources, but breaking them into, and that's what makes our revenue and some of our funding is really complex, is all the different sources. But in general, breaking them into these categories, There's the county tax levy that funds our core budget at $942,155. That is about 11% of our budget. The placement tax levy, which you routinely see, is about $1 million. Medicare and Medicaid funding, $2.2 million. This year we had the routes to recovery funding, as well as some other programs had COVID specific funding at approximately $91,408. A lot of that funding, or a few of those funding strings also are carrying into this next year. So we'll still see that in the next year's report. Other funding, other funding could include things like donations. I guess I should have listed a few of those. You have like donations in public health. I think what other things, big things fall in that category. I'll come back to that. State allocation, basic county allocation, a little over 1 million, and 2.4 million in other state programs, which would be like our Birth of 3 program, some of the children's programs and whatnot. Moving to page 75.
A question, please.
Sure.
The difference between the tax levy and the tax levy placement.
Yep. Okay. So the tax levy is what funds our core budget. And when you look at the original financial report that we showed earlier, today we talked about that blue table that talks about placements. The 1.9 and $619, that is for the placement. The county puts that aside for placements only. So the $942,000 though just funds Health and Human Services operations. Does that make a little more sense?
Go ahead, Robin.
Okay, it's hard to hear. So moving to then the other table on page 75, it shows what our actual or what our budgeted agency expenses were in actual. We came in under budget at 6.4 for our agency. And then the bottom table shows 2019 as a comparison to 2020. That actually is for whoever asked that question. I'm sorry, I couldn't hear it loud enough to who asked that question, but on the bottom table, you can see in the red, the 1.9 million is what the county puts in for the placement expenses. And then 2019 and 2020, you can see in the blue what our actual expenses are. That's it. Any other questions on that?
Robin, this is Tim. So I'm doing some quick back of the napkin math here. So it looks like revenues were up from projection significantly more than just the COVID funding. Like about
we had Tracy had done remember that Tracy that write up we had did. There were unfilled positions in 2020. Let me quick see if I can pull it up to let's see where to go. If I can speak to exactly.
While Robin's looking for that, I think speaking of our revenue being up, probably was tied a lot more to CCS.
Yes, revenue specifically, yes.
Revenue through that. And certainly I know Robin was referencing with unfilled positions, our expenses were down, but I think the revenue.
Right, sorry.
The greater services that we were able to do.
So
that she referenced to both, and I'm just not putting my finger on it, but
so in addition to the reduction of 430-ish thousand underspending, revenues went up significantly thanks to CCS, so we're able to cover most of that overage for institutionals, with the exception of the 110,000 you have here. Am I tracking correctly?
That's roughly accurate until the audited numbers come through. We'll see if we're right about that.
That's really great.
Yeah, I'm not putting my finger on it, but generally what Tracy's saying is correct. Our revenues were up in CCS, and what made the bigger difference though were the expenses being down in some cases too. It's not just revenue up, but expenses being lowered for other reasons.
Yeah, I know I've said this several times, but expenses being lowered isn't necessarily a good thing. We haven't been able to have some of those services that we think are necessary in the community because of probably the recruitment issues. So I think that part we would like to see us get back to fully staffed, really see what the impact can be of having sufficient services in the community.
Are there any board members that have any questions on our annual report that was just gone through?
Mr. Chair, I just want to thank the board for sitting through and hearing all of the presentations. I know it's a lot to take in. There isn't much opportunity for our staff to be able to tell you all about the vast majority of things that they do. So I appreciate your attention to that.
Are there any other questions or comments from the public?
I did find that handout I was looking for. The other notable thing, Tracy, was getting a much larger payment back from WMCare than we had planned. So yeah, CCS money. Well, not just CCS, but yeah.
Any other comments from the public if they're available?
I just want to say thank you to all of you who prepared that and gave the reports. It was very good.
Hearing no further comments, we'll move on to our next agenda item, which is number 14. Schedule our 2020 budget public hearing in July. Normally this meeting is held at nighttime. It has been for the last 3 or 4 years. It has been held during the daytime before. It's up to us whether we want to have it at night to allow the public to come and speak, or during the daytime if we feel that they're available also. What are your wishes? You want to keep it on to a Thursday, the second Thursday of the month at nighttime, or different day?
Just to add to what you're saying, Mr. Chair, we're required to have an annual public hearing. So we would have that probably kind of in conjunction with the board meeting, that the beginning of the meeting could be the public hearing, and then when that closes, then the board meeting could continue.
Would that meeting take place here, or, I mean, historically, has there been a lot of public involvement?
I would say that it varies from year to year. It's probably never been substantial. If there's an issue either anticipated out in the community or something different happening, it seems that that's when people want to come and speak about it. So sometimes we have nobody show up, and sometimes we have several people show up.
My preference would for it to be at night. I think for some people it's harder to attend when it's held during the day. I don't know if you've seen an increase when it's been held in the evening, but that was something I always felt was helpful. Certainly if staff have input too, that, you know, it's more available to staff or other working people in the community if it's in the evening.
Yeah, we probably back in 2017, I think we moved to a nighttime public hearing. A couple people would show up, that would be about it. But I'm certainly in favor of keeping it the second Thursday of the month at 7 p.m. I think we met, didn't we? 5 p.m.
I think it was
5 p.m. 5 p.m.
The other issue too is our staff would be a little bit longer at work. But
yeah, I in terms of that, staff are able to flex their time, so or comp time so that they could take that off later. So we'll adapt to whatever the board decides.
So it looks like we have be the 13th, huh? Or the 15th?
I think it's the 8th.
The 8th?
Chair.
Correct. It'd be July 8th, the week of 4th of July holiday.
I'm looking at my work schedule here, so that's why I was kind of off, because I'm on this new schedule. So I'm free the 8th at nighttime. I usually work nights, so. I'm gonna do 7/8, July 8th at 5 p.m. in the county boardroom. July 8th.
Thursday.
Yeah, Thursday, July 8th in the county boardroom at 5 p.m.
Would 5:30 be agreeable for
Sure.
the working folks?
I'm fine with that.
Mr. Chair will continue to make the meeting available via Zoom as well. Public could attend that way as well.
Is MIS okay with that date and time? Or
I will learn how to do it, what Barb does.
The problem is, although Teresa's staff can flex her time and gets comp, my staff gets no comp and doesn't flex. So we just work extra hours, no extra pay. So it's fine, we'll make it work.
so you're okay with helping us out?
Doesn't matter if we're okay or not.
All right. Let's move on. We completed the end of our agenda item 15. Would someone entertain a motion for adjournment?
I'll make a motion to adjourn.
Motion by Diane Cox for adjournment. Is there a second? Seconded by Mrs. Chicker. All those in favor signify by saying aye.
Aye.
Those opposed say nay. Motion carries. Meeting is adjourned. Thank you, everybody, for attending.
Approve those vouchers. Thank you.